Hello, everyone. Thank you for joining us for today's Health Action webinar, Immigrant Health Under Attack, Trump's Public Charge Rule. This is Claire McAndrew at Families USA, and we want to welcome you today to this webinar that we are holding in response to a regulation that the Trump administration finalized last Monday, August 12th. This regulation, scheduled to go in effect on October 15th of this year, takes direct aim at middle and lower income immigrants who have followed a lawful process to enter the United States or who are seeking visas to enter the country. And as we will hear today from our speakers, this rule essentially forces people to choose between entering or staying in the country or accessing the services that they need to thrive, whether it's assistance with health care, with food, or with shelter. The government's mechanism for forcing this choice is a public charge determination. And under the new rule, the definition of a public charge will be based on whether someone is more likely than not to receive certain public benefits over the course of their life. And if immigration officials say that they meet that test, the immigration status they seek can be denied. So we have really excellent speakers with us today who are going to discuss the details of this rule and how it intersects with health and health care and what advocates can do to respond. So today we're going to hear from Gabrielle Lessard. She is the Senior Policy Attorney at the National Immigration Law Center, and she will start us off today with an overview of the public charge rule. We will then hear from our own Cheryl Fish-Parcham here at Families USA. She is our Director of Access Initiatives, and she's going to talk about how the public charge rule intersects with health and health care to create some very big risks to health and health care in our country. We then will hear from Cecia Aquino. She is a Senior Policy Manager at the California Immigrant Policy Center, and she is going to talk about what is happening at the state level to push back and inform communities based on the California experience about this very harmful rule. Of course, we will then have time for questions and answers, and if we have some time between speakers, we can take questions then. But otherwise, we encourage you throughout the entire webinar to rely on the question box you can find on your screen. Whenever you have a question, feel free to put it there, and we will have time to share those questions with our speakers throughout the webinar and get your questions answered. So you'll see on the next slide just a little bit of housekeeping that we are recording today's presentation so we can make it available to you after and to folks who couldn't join us today. So again, just keep your questions coming in that chat box. And with that, I want to thank our first speaker for joining us, Gabrielle from the National Immigration Law Center. I really can't stress enough how critical NILC has been to the rapid response effort, and even before the rule was finalized, to really organize comments and push back against this harmful rule. So we're very grateful for Gabrielle giving us time today during this really crucial effort. And I'm going to turn it over to Gabrielle now to provide an overview of what this rule is and what it means.
Thanks, Claire. Let's just go to the next slide. So I'm with the National Immigration Law Center. Our mission is to defend and advance the rights and opportunities of low-income immigrants and their family members. We do not practice immigration law. We combine policy analysis and advocacy, impact litigation, and strategic communications to protect immigrants' rights and to advance their access to health care, education, and economic opportunity. Next slide. Next slide. Okay, so just some background, what we are moving from. Public charge has been part of immigration law since the late 1800s, which is why that image depicts 19th century European immigration. And a public charge has historically been a person who's dependent on the government for financial and material support. Under guidance that's been in effect since 1999, this has meant a person who is participating in either cash assistance for income maintenance or institutionalization for long-term care at government expense. Next slide. So it's important to note that not all immigrants are subject to public charge. There are a number of exemptions for people who've come to the U.S. for humanitarian reasons, including refugees and asylees, survivors of trafficking applying for or who have T visas, survivors of other serious crimes applying for or who have U visas, self-petitioners under the Violence Against Women Act, special immigrant juveniles, and others. Next slide. So public charge, it's a ground of inadmissibility under immigration law, and it's assessed when a person first applies from outside the United States to enter the country, and that's either as an immigrant or non-immigrant, like someone on a student visa. and then also when they apply to become a lawful permanent resident, which is sometimes called getting a green card. Once a person has become a permanent resident, there's no public charge test when they apply for citizenship, but a person who has become a permanent resident who leaves the country for 180 consecutive days will be assessed for all the grounds of inadmissibility when they return, including public charge. Next slide. So it's really important as we move to this new rule to understand that the public charge test is forward-looking. It's looking at whether a person is likely to become a public charge in the future based on the facts that are relevant to their ability to support themselves today. A person does not have to have used any benefits to be deemed likely to become a public charge. Next slide. So one more. Okay, so moving to the Department of Homeland Security regulations that were published last week. They create a dramatically different definition of public charge, as Claire said. They also take the existing totality of circumstances test, the one that looks at all the facts, and they add a number of weighted factors to that test that are really intended to make it harder for low and moderate income people and people with health conditions to pass that test. And then they also add additional public benefits programs that can be considered as negative factors by immigration officials. Next slide. Okay, so in terms of the standards and evidence, the factors age, health, family, financial resources and income, and skills and work experience are statutory. And what the regulation has done is it's added a number of standards to those. So under health, they are now considering it a negative factor if a person has been diagnosed with a medical condition that could affect their ability to work or study or take care of themselves, or that could require extensive care or institutionalization in the future. Under financial resources, they add a new wealth test that makes it a negative if you don't have an income of at least 125% of the federal poverty level, which is about $32,000 for a family of 4, or substantial assets. For people who are active duty military, that income test is 100% of the federal poverty level. But for people coming from poor countries, that still could be a substantial burden. And then they will also look at whether the person has applied for or received any public benefit in the past. Under skills and work experience, they've also added a number of standards, including an unprecedented assessment of the person's proficiency in English. Next slide. They also add heavily weighted factors, and these largely double down on the standards that are added to the existing statutory factors. We don't have time to read through all these, but you'll have the slides to look at later. Note that this doubles down on the diagnosis with a medical condition and also makes it a heavily weighted negative factor if the person is uninsured without the prospect of receiving private insurance or paying out of pocket for any needed care. Next slide. Next slide, please. There are a few heavily weighted positive factors, which are essentially just that the household has income or resources of at least 250% of the federal poverty level, which is over $64,000 for a family of 4, or that they have private health insurance, but ACA plans that receive advanced premium tax credits are not considered private health insurance for this purpose. Next slide. So in terms of the additional benefits considered, and remember, a person does not have to actually receive any benefits to be considered likely to become a public charge. It just has to be assessed by the immigration agent that they are more likely than not to receive one in the future. So the benefits that are considered are federal, state, local, or tribal cash assistance for income maintenance, as under the existing test. And then they add certain non-cash essential benefits, including Medicaid with some exceptions, SNAP, formerly called food stamps, Section 8 housing assistance, both vouchers and project-based, and public housing. Next slide. All of the benefits that are not explicitly listed there are not included. That includes things that showed up in earlier versions of the regulations, including Medicare Part D financial assistance, school-based nutrition services, WIC, tax credits, State and local non-cash benefits are not included, and benefits received by someone else, including a child of someone who's applying for status, are not considered as negative factors under the test. Next slide. So in terms of the exceptions for Medicaid, services received for an emergency medical condition, as well as health benefits, either Medicaid or CHIP, received by a person under 21 years of age, health benefits received by a woman during pregnancy and for 60 days postpartum, and also benefits received while a person was exempt from public charge. So for example, if a person was a refugee exempt from public charge, but then for some reason they decided to adjust their status through a family member, which is a non-exempt way, then the benefits they received as a refugee would not be considered. Next slide. Okay, so things to keep in mind, especially as we're talking to consumers. This rule is not in effect yet. It only applies to applications for visas or adjustment of status that are submitted on or after October 15th. Any applications submitted prior to that date will be adjudicated under the existing standards. The newly named benefits used prior to October 15th will not be considered retroactively. Also to keep in mind that not everyone is subject to the rule. It only comes up at particular points during a person's immigration process, and there are a number of exemptions. Very important that people understand that benefits used by family members don't count. And also important to remember that it's a totality of circumstances test. That means all facts and circumstances, so that positive factors like having education and good job prospects can be weighed against negative factors like having a low income currently or having used benefits in the past in this forward-looking assessment. Next slide. So in terms of advocacy asks, there is a bill in the House, which is H.R. 3222, no federal funds for public charge, would do just what the name says. Ask your members to co-sign that, ask your senators to introduce it in the Senate, and also ask your member to speak out in opposition to the rule. And then all of us can directly get involved in partner and community education. We need to update our resources and materials and figure out how to deal with issues and questions that are coming up from community members and allies. And also, we would appreciate it if you let us know what questions you're getting, because we have an evolving frequently asked question document that we're trying to get out to the field so that we don't have to answer the same question repeatedly. Next slide. In terms of getting your materials together, we have a number of resources available. So we have updated our documents called Let's Talk About Public Charge and Getting the Care You Need. And then we have translated materials about access to health care. We also have templates of our materials that are available for organizations to customize with your branding. So you can add your contact information, you can add information about other programs that your jurisdiction offers to immigrant families. So just email my colleague, Kat Lundy, and she will get you a template that you can edit. And please be patient with us as we are responding to a lot of requests at this time. Next slide. Okay, and then we also have organizational resources. So we have a communications toolkit as well as a digital toolkit available. And we have set up a portal to take questions from our organizational partners so that we can, sort of allocate them to the people who are best able to answer them, and then channel the questions that are asked frequently into our frequently asked questions document. And please note that this is for organizational partners. We cannot give advice in individual cases. And I will turn it back over to Claire.
Gabrielle, thank you so much. You did such an incredible job of expressing this quite complex information in a very clear and quite quick way. And to that, we have a clarifying question from one of our partners in Oregon who was wondering if you could just clarify what happens for people who have applied for benefits in the past, and they're particularly interested in this given that they have a integrated public benefit eligibility system, so there's a lot of fear there. So if someone's applied in the past, what does that mean for them?
Okay, first of all, if someone applies prior to October 15th for any of the non-cash benefits that were added by the rule, DHCS, or sorry, that's our Department of Health Care Services, DHS, cannot look at that. It's only going forward after the effective date for the newly added benefits. If they applied for cash, then that can be looked at. And the way that applications for benefits are looked at is that under the totality of circumstances test, they're one of the elements under the income and resources standard. So that can be offset by having a higher income now, or having other factors in your favor, like having gotten more education or currently being employed.
Well, thank you so much for taking that question, and we are going to have more questions at the end, but for now, I'm going to introduce our very own Cheryl Fish-Parcham. She's been a leading advocate here at Families USA for over 20 years. She's seen people gain benefits and see a lot of threats to their benefits, so we're very grateful to have her here working to protect people's health care as we see this public charge rule come down. And so she's going to be talking now about the intersection of the public charge rule and health care benefits. So Cheryl, thank you so much for being here.
Thank you. I'm going to go over some of the things that Gabrielle has already told you, just to explain how they are really going to harm health and health care. And the things I'm going to be talking about are how this discourages the use of Medicaid, negatively weights medical conditions and disabilities in a way that really discriminates against people with medical conditions and disabilities, positively weights private insurance but not marketplace coverage, uses bonds but not to protect people, and how this will have a very negative impact on the healthcare system. So first, just to reiterate, this is about an adult using Medicaid over his or her lifetime. It does not affect children's use of Medicaid and CHIP, and the rule clarifies that it doesn't apply to emergency Medicaid, to pregnant women, to postpartum women, or to benefits received before October 15th. Now, you may have heard in earlier versions of the rule all of those things were threatened. Those didn't come to pass, so educating people about who is really discouraged from using Medicaid is going to be one big task for advocates. Also, as Gabrielle mentioned, this applies to future use of Medicaid. And as you know, most adults must be lawful permanent residents for 5 years to get Medicaid. So this is really future-looking, not past-looking. But there are some people who will be affected if they use benefits once this rule goes into effect, and those include lawful permanent residents who then leave the country for 6 months or more and seek to come back in. So I guess imagine an immigrant who is now lawfully living here and goes home to take care of a parent for 6 months who's ailing, and when they come back, they may be subject to this test. The next really sort of harmful element, besides looking at the likelihood that someone will use Medicaid in the future, is the weight that this rule gives to medical conditions and disabilities. And it really opens the door wide for prejudice on the part of immigration officials, because the rule says that they are allowed to take into account evidence of a medical condition that is likely to require extensive medical treatment or institutionalization, or that will interfere with the alien's ability to provide and care for himself or herself, to attend school or to work upon admission. And this is all a heavily weighted negative factor unless the person has private insurance without premium credits or has the means to pay. Next slide. So this really gives DHS a lot of discretion to guess the likely course of a medical condition and whether it's going to be expensive or not, and to decide if a disability will interfere with care or school or work. And as you know, many people with disabilities do work. About 33% of people with disabilities are able to work with adaptations. And so how immigration officials will take this into account is a scary prospect. Considering private insurance as a positive factor only without premium credits is also really unfair. The percent of the non-elderly population who has had job-based coverage has really declined over the last 10 years, and more people are working for gig economies, for employers that are hiring them on a contract basis without providing health insurance. So this will also negatively affect low-income people and many other people. Next slide, please. The other unfair aspect of this is that if this is about what the government pays for, well, the government pays for a lot in terms of health care for people who are far richer than the people who are targeted under this rule. People who have job-based coverage have a tax break on their coverage. HSAs, HRAs, and FSAs are also tax-favored and subsidized benefits. So this is the fact that you can consider private insurance offered through the marketplace with subsidies as not being a helpful benefit, but job-based coverage as being a helpful benefit is really discriminatory. There's also the other aspect of the rule is that if DHS says that they think you're likely to become a public charge based on the totality of of your conditions, and that you might use medical care. If you can buy a bond of at least $8,100 to avoid being considered a public charge, and there's no real upper limit to what those bonds might cost. And once you get a bond, it doesn't help you get care. It just guarantees the government that they won't lose that money. So there's a lot of problems in this rule. It will cause uncompensated care to increase as people become fearful of using Medicaid benefits. It will strain providers who may just not be seeing patients at all, and therefore it will also impact the public health. There will be Medicaid eligibility workers who will be confused about this, as well as people themselves being confused about this, and so all hands will be needed to help educate the public and Medicaid eligibility workers about who is really not affected by this rule. And we really encourage you to join efforts like the ones that Gabrielle has described to push back against the rule.
Well, Cheryl, thank you so much. We know that this is really creating a very bleak situation for a lot of people's access to health care. So many people depend on Medicaid. It's certainly become part of the fabric of our healthcare system, so this is really jeopardizing people's ability to access care. You mentioned how children are treated under this rule. Are children treated differently when it comes to health care versus other services? What about things like SNAP, like that? I think there's been some folks wanting some clarification on that.
Yes, this is an exception for medical care, not for other kinds of benefits.
So really, when you think about kids, they might be safe to apply for health benefits, but if they need assistance with their access to food, even children are subjected to that. So it's hard to sort of parse those things out and will create a lot of fear, which is a big concern. And of course, we've already seen the chilling effect that even if there's these exceptions, communities need a lot of help to understand who is eligible and who isn't. And there's been also some questions that we see coming in related to the 5-year bar for immigrants. So if immigrants have to wait 5 years to sign up for Medicaid, how does this rule interact with that 5-year bar?
Well, as I said, if someone leaves the country after they've gotten Medicaid after 5 years and then seeks to come back in after an extended stay, this will be a problem for them. But mostly this is a future-looking test. What is the likelihood that you're going to get Medicaid over your lifetime? So that's the main thing. If you're an immigrant and you're seeking a lawful permanent residency status or another status, if you're coming in as a visitor, they're going to assess what's the likelihood that you'll use Medicaid over the course of your lifetime. I guess just think of a foreign student who is here and has a mental health crisis. If you were a U.S. student born in this country and you had a mental health crisis, you might take time off school, go home for a few months, then re-enter school, and that's not going to count against you. If you're a foreign student and you go home for a few months, they might decide, oh, well, it looks like based on your medical condition, you might use Medicaid over the course of your lifetime, or based on your medical condition, maybe you're not going to be able to study, and this would be held against you.
And so one of the participants on the webinar is wondering, like so many other programs, are there appeal rights for determinations of public charge?
I'm going to turn that back to Gabrielle.
Great. Gabrielle, the question is if there are appeal rights for public charge.
You know, I actually
Gabrielle?
don't know. I know that in the consular processing context, there's often an ability to submit additional information to show that you're not likely to become a public charge. But here, when you're working with USCIS, I don't know. But let me see if I can find that out by the end of the webinar.
Well, thank you so much. You know, that's a great question. We know that if you don't know it, it's probably something that's buried deep. And you know, even if people can appeal, it's such a risky system to find your information already floating in. We'll take one more question now. Gabrielle, this is probably a good one for you to just clarify. The categories that public charge is relating to, someone was asking, is it applying for asylum status, visas, and citizenship? Is that the correct list of categories someone was asking for clarification on?
Asylum status is exempt. So remember all those categories of humanitarian immigrants who are exempt. That includes asylum.
Mm-hmm.
It is when you are outside of the country applying for permission to come to the U.S., and when you are applying for lawful permanent resident status, also called a green card. Once you get your green card, there's no public charge test when you apply for citizenship.
Thank you. So again, people who are here for asylum or seeking refugee status, they are not part of this, but the other categories are. So we're going to have, again, another time for questions at the end. And I know there are additional clarifying questions. This is a very complex rule. I would urge people to continue your questions, but also please do refer to the resources that Gabrielle mentioned. We are going to send out the slides after this. We will make sure that everyone gets those resources. I also want to mention that just going live during this webinar is a new analysis from Cheryl Fish-Parcham that gets into a lot of the details she covered relating to the intersection of health and healthcare. So you can find that on our website, but we will be circulating the slides and a recording of this webinar after, because I know there's a lot of information to take in here. So with that, I want to turn things over to Cecia Aquino from the California Immigrant Policy Center. Of course, at the federal level, it's quite clear the intentions of the federal administration, but we have states that are really trying to figure out everything they can do to try to protect people in their states. We know that in California, the Attorney General has already moved to file a lawsuit regarding the public charge rule, and that we have a lot of folks in the states who are trying to get clear information out to communities and push back on this. So we're so grateful to Cecia for joining us to talk about the California experience on pushing back on this rule. So Cecia, please take it away.
Muy buenas tardes, and thank you so much for having me. So we will get started. We can go to the next slide. So our California response, as you know, the California PIP Coalition is really the state branch for our national PIP campaign, Protecting Immigrant Families. And CIPC anchors the California PIP campaign to oppose expansion of public charge and ensure immigrant access to the safety net. As part of this work, we ensure a coordinated, powerful, and multi-sectoral response to the impact of public charge, including state investments in outreach, education, and legal representation. I'll walk us through some of the components and phases of this work. Next slide. So, truly, our mission with the California PIP Coalition is to address public charge threats in California by empowering families with the information they need to make an informed decision. So we covered this through 3 different phases. Our phase 1 was creation and coordination. And our focus here was to maximize reach to our immigrant communities by streamlining partner efforts. In our coalition, we have over 140 members. So truly, it was important to organize our group in a strategic manner and create focus areas that would really highlight our partners' interests and expertise. And we'll walk through some of that in a couple of slides. Our implementation phase focused on tapping into already existing networks for implementation across each of the focus areas. So for the information that we're creating, the educational material, ensuring that we're sharing that through networks that already exist, that are trusted by community members, and that would help enable action from our communities. And phase 3, policy change. So this is more of a structural, focused, long-term, analyzing and organizing potential policy solutions that would address the root of the problem. So everything from increasing access to public benefits, such as we're doing with our Health for All campaign, and also transforming the immigrant narrative. So what does it mean to be an immigrant in California and the U.S.? Next slide. Our first working group, Outreach and Education, really focused on increasing access to important educational material that our diverse audiences, everyone from impacted, directly and indirectly impacted families, to media, ethnic media, legislators, so that they could truly understand the intricacies of this confusing law. And that included everything from public charge educational materials, fact sheets, to providing accessible legal resources. In California, we have our One California Attorney Network, which we made sure to communicate to our communities. Our second communications team really had a unique challenge of refocusing the narrative and refocusing the way that we were messaging to communities. So pivoting from a just don't disenroll message to truly refocusing the power to the communities. So sharing messages such as, you are supported, California has your back, and advocates are fighting for you, you belong here, you have rights, make an informed decision for your family. So truly for families to own their power. And that messaging informed the rest of the action items that we followed through with, such as engaging ethnic media, making sure that the information that they're sharing is not spreading fear, but information, having a unified messaging strategy, so sharing a media toolkit with our coalition partners so that we could all have a unified message, and translation, so ensuring that the information that we're creating and sharing is accessible in multiple languages. Third, our legislative advocacy group really focused on engaging legislative advocates to both stand up for families by speaking out against public charge, but also by providing resources and avenues for outreach and education in their districts. So that led a lot of really good conversations and partnering with our legislators. Our administrative advocacy focused on ensuring the efficacy and efficiency of our administration by creating a patchwork of publicly funded and community-based resources, as well as scanning statutory authority for opportunities to enact further defenses. So everything from continued advocacy for state funding for our One California Attorney Network to streamlining communications with agencies such as HHS. And our legal capacity. Our legal capacity team joined forces to increase access to legal counsel, especially during the 60-day grace period that we're currently in. So this team is organizing legal clinics in LA County, and we're partnering with other organizations to ensure that we're covering the rest of the state. Next slide. Our California government in action. So our government leadership really has done a great job in setting the tone for all of us in the state. So from a state resolution that our legislators have been moving forward with ACR 1 to formal litigation, like you mentioned earlier, led by Attorney General Becerra, I would say the true power of California government has focused on ensuring effective outreach, education, and interagency coordination, from conversations where HHS is asking, what does the Department of Education need to know, and are we all on message, so that families, no matter what stage of life they're in, are receiving the same unified message that empowers them to make informed decisions for their family. but also realizing the great structural power held in government to ensure that systems that are currently in place address the needs that we are seeing. So funding allocation, statutory convening authority, ensuring that the money that is already in place, that is ensuring outreach and education for different programs, is now including also public charge information and the statutory convening authority. So everything from creating groups, stakeholder groups that would come together to provide ideas on solutions to address the chilling effect or different intended consequences of the fear this rule is causing. Next slide. And finally, so these are some lessons learned and some suggestions on how other states can now take action. Next slide. So firstly, starting with our outreach and education focus, ensuring that families have access to timely and accurate information about the public charge rules through frontline staff training, ensuring that people who have communication with our families one-on-one and people who our families trust have that conversation about disenrolling or more information about public charge, to community outreach, presentations in language, and also, like we mentioned, interagency coordination. 2, ensure that families directly or indirectly impacted have access to accurate legal counsel and alternative public benefit resources. So if we have families that will be directly affected by these public charge rules, are we thinking about what other resource networks we have that they would be able to access without a problem? But also legal counsel. So we've heard from the ground families want to discuss the decision with a legal provider, so ensuring that people have access to that. 3rd, enact policies to protect sensitive locations, clearly mark and declare safe spaces. One of our partners, WIC, here in the state, is actually creating posters to put at their sites to ensure that people know they are safe, that WIC is not included in the list of public benefits, and so that families continue to benefit from this wonderful program. 4, lead a comprehensive analysis of statutory schema regarding privacy and confidentiality of personal information in government databases that the federal government and ICE may access. So ensuring that our family's information is safe. 5, monitor state and local enrollment data to identify growing unmet needs in the community in real time. So if we're seeing families drop out of food stamps, and ensuring that we have those benefits to provide in an alternate source. 6, structural change. Expand access to state-funded public benefits. So this will take more of a push and campaign, but creating programs that provide access regardless of your immigration status. And 7, support a state resolution. So just the way that the state of California has pushed forward ACR 1, which really sets the tone for the state, and families feel represented and like our leaders are really standing up for their rights. This is something that all states can take into account and can actually enact to set the tone for their own state. I will stop there. Any questions?
Thank you so much, Cecia. We're so grateful for your leadership in California, and to your colleagues, too, in your California government for really giving the nation an example of how to respond to this threatening regulation. We have a question regarding how safety net providers can be involved, and how can safety net providers reach out to FQHCs and Medicaid providers to let them know that they're a resource for people who are uninsured and dealing with this rule. Have you seen that kind of work done in California, and do you have any advice or examples to share?
Definitely, and I will be happy to share these resources after we finish this conversation. But one of our partners, CPCA, alongside our coalition, has created train-the-trainer modules that not only people here in California can use, but all across the U.S. to really train the providers. And a key point here is providing those staff and colleagues with the right information. So just having a list in front of them of who is directly affected, who is not, what programs are directly affected by public charge and which are not, so that they can help families make that decision. There's also another resource through our partners in San Mateo County through the Libre Project, and they have created a screening tool that helps people walk through their information, their case, their status, and at the end provides either a green, yellow, or red light, ensuring that people know that they would be directly affected based on their answers, or they wouldn't. So providers and other people who have that FaceTime with community members can really help to walk families through the intricacies of this law.
Thank you so much. That's really helpful. And is that the same kind of advice you would give to Medicaid eligibility caseworkers?
Yes, but for Medicaid, because of the different exceptions, I would advise that they have those exceptions in front of them. In California, we're expanding benefit to young adults regardless of their citizenship status. So in order to ensure that those young adults and families are not scared from accessing the benefits, we are making a key message to communicate that state-funded programs are not affected by public charge. So ensuring that Medicaid enrollers have that information in front of them and that truly understand what this rule is.
That's really good advice. So one of the participants is asking if immigrants in California receive benefits through county programs or state-funded programs. Is there any possibility that these services could end up somehow reported to DHS and affect their citizenship status?
So it depends on what public benefit program we're talking about. I mean, the assessment covers different factors. So if it's state-funded, then we know it's safe. For example, in California, we have CFAP, which covers food stamps for those ineligible for CalFresh, but doesn't cover the undocumented. In terms of reporting back, there might be a chance, but...
This is Gabrielle. Can I jump in?
Yes, please.
There's one state-funded benefit that would be considered as a negative factor in public charge, which is the Cash Assistance Program for Immigrants, or CAPI.
That's right. So I think for that question, it would take a lot more intentionality of understanding what public benefit we're talking about and then providing the advice based on that.
Well, that's really helpful. And what I heard you saying before is that there's things the state can do to design programs that are state-funded and are very separate of the information that goes to the federal government that are designed to have firewalls. Is that what I heard you say, and to help protect people? Is that something that your state can do and any state could do?
Correct. So taking the time to ensure that privacy is number one priority and that families feel safe accessing the different public benefit programs.
Okay, because I think that was the nature of the question. It's knowing that if a program is set up and administered by the state, your state does have the power to protect that information from federal databases.
Correct.
And I think, so there was another question too, and I think these questions really reflect the kind of fear that's out there in communities, because another question was asked that, could it even be risky to go to a food pantry? Could that be considered public assistance? Could somebody gather someone's name in a food pantry and somehow have that go back to the federal government and be counted as public charge?
So I completely hear you, and I think that's the same fear that our communities are facing, and that's why even WIC has been flagged as a red flag for our families. So truly, we have to do the work to educate, reach out to communities, and ensure them that if the public benefit is not listed on that list that Gabrielle went through of the public benefits that are directly affected by public charge, that families can access and should continue to access those public benefits.
I think that's really a key point, Cecilia, that if the programs are not specifically listed, if it's a food pantry, if it's a county or state-funded program that is not interacting with these federal programs, it is completely safe for people to use them, and they will be able to get their needs met, because people have to continue to get their needs met. There has to be a way, and states that have the will, like California, can protect people. So
yeah,
we have. Thank you, Gabrielle. Go ahead.
Emphasize that the people that are going to be subject to the public charge assessment are very rarely eligible for any of the benefits that would be counted by the new rule. So, you know, the same people might be penalized for being low income, but people really, you know, they need to understand the exemptions and when public charge is assessed. And when you look at that, you know, we actually had to work really hard to come up with some examples of people who would be subject to a public charge test and eligible for benefits.
Well, thank you. And so we have questions, and these really are for all of our speakers. This one might be good for Cheryl, but someone was asking about folks who receive Medicaid for long-term care. How is that looked at in the public charge rule?
So there's one of the aspects in the totality of circumstances are whether someone has a medical condition that is likely to require extensive medical treatment or institutionalization, and they don't have the financial resources to pay. That is looked at for the reasonably foreseeable medical costs. So I guess a person could argue that long-term care for an elderly person who isn't elderly yet might not be reasonably foreseeable, but I think that will be a contentious issue about whether too much discretion is being used in trying to decide that. I do add that, you know, this is looking at Medicaid use over your lifetime, and that's one of the scary aspects of this rule. You know, 1 in 5 elderly Medicare beneficiaries uses Medicaid to supplement their Medicare benefits to pay for cost sharing under the Medicare Savings Program. So that's why we're so concerned about the discretion.
And I have an answer about the appeal question. The question whether a denial on public charge grounds could be appealed. There's no appeal of a denial of adjustment of status. You know, that's when the person is applying to become a permanent resident. Although there is a process for filing a legal motion to reopen or a motion to reconsider the case. And then people who end up in an unauthorized status as a result of being denied the opportunity to adjust will actually receive a document called a notice to appear, which is the beginning of a removal, also called deportation proceedings. That gives them the opportunity to appear before an immigration judge and make their case, and the judge will consider not considering any of the prior precedents. So they'll give it what's called a de novo review. They'll consider the case without being influenced by that prior denial.
Thank you, Gabrielle. And so this might be a good question for you too. In terms of who's actually making the determination regarding if someone gets legal permanent resident status, or whatever someone's status should be, is that determination regarding public charge and their status made by a local immigration officer? How uniform will these decisions be, and how uniform will it be for different people in terms of how the public charge determination is made?
It's made by a person who works for USCIS, U.S. Citizenship and Immigration Status or Services, in a local office. And one of our concerns about this rule is that it's subjective, and there's a very high likelihood that two people who are similarly situated would have different outcomes.
Well, thank you for that.
Probably a good opportunity
That's
to tell people that we have filed litigation.
Yes, and we are very grateful for that. I think in Cheryl's new analysis, she talks about that litigation, and I know that you've all done a good job of promoting it, and I think it's very important for folks to know that there are multiple lawsuits filed into this about this public charge rule, which is a good sign of hope. So there's a clarifying question about marketplace coverage, and I think it's just good to let people know that marketplace coverage and marketplace subsidies are not included in the final version of the rule. The healthcare provisions relate to Medicaid and Medicaid funded assistance with Medicare, but marketplace coverage is not considered part of this, and I'll let Cheryl continue.
And so marketplace isn't considered a negative factor. If you have marketplace coverage with subsidies, that is not a negative factor for you. Neither is it a positive factor. So, if you have a medical condition and you say, oh, but I'm going to be able to get private insurance with subsidies and that will pay for my medical condition, so don't worry about my costs. Unfortunately, you can't do that because it's not considered a positive factor the way private job-based coverage is. Gabrielle, do you want to add anything about that? Did I get that right?
No, that's right. It's not considered a benefit. It's just that one of the heavily weighted positive factors would be that you had private insurance. And just for that specific provision, it says that ACA coverage with subsidies would not be considered a private insurance.
So there's a question here about these weighted factors. Some skepticism about this calculation of totality. Is it really going to be weighted fairly? Really, could any negative factor actually lead to someone being considered a public charge? What do we know about that?
I think that unfortunately it is going to be left to the discretion of individual USCIS agents.
So that really gets back to what you were saying before, that different people in similar circumstances could end up in a different situation. So thank you for filing a lawsuit to help maybe get some justice around that. There's still a lot of questions here around the sort of specific definitions of how public charge is applied. For example, if a family member has been on public assistance, will the specific person applying for a change in immigration status be hurt? Can you remind folks, Gabrielle, of how that works?
So the rule specifically says that benefits that are received by people in your household of which you are not the beneficiary will not be considered in your case. Now, there's a current practice of looking specifically at households that have child-only cash grants and have no other income source and attributing that benefit to the parents, essentially. We don't know if that practice will continue or if it will be reversed by the provisions in the proposed or in the final regulations.
And can you remind folks again, is the public charge determination based on receipt of benefits or even if you've applied?
It includes whether you've applied, but you don't have to have ever applied for or received any benefits. The agent is looking at whether based on your age, health, family status, income and resources, and skills and education, whether you are more likely than not to use benefits in the future.
Right. Well, thank you for re-clarifying these things. I think the complexity of this rule is such that these questions, need to be heard again and again, and we're going to also be sending out resources so people can review this in writing. We'll send out resources that are more detailed, less detailed, so people can choose their level. But if folks are feeling confused, that's normal because this is a very, very complex rule. Some might think it was even complex by design, because there's a level of a chilling effect of fear that this rule creates that might make people hesitant to apply, even if they'd likely be safe from the public charge. So it's understandable if folks are feeling a little bit confused even still, but we're hoping that this has demystified some of this rule, and we will be sending out resources after that we hope you will be able to rely on to answer further questions. And of course, if you do have further questions, you can always contact us at Families USA. If we can't answer them ourselves, we'll probably be hooking you up with Gabrielle, and we'll be hooking you up with Cecia, because this is a complex rule, and we're still even digging through to understand all of the implications for immigrants, for healthcare, and what we can all do about it together. But we really do want to thank you for taking the time to dig into this to understand how it's going to affect communities. So stay in touch, and we'll be sending out more resources. Look for a follow-up email, and we know there's some detailed questions we were not able to get to today, but take a look at the resources. If they don't answer your questions, just get in touch, and we hope you'll join us for our webinar in September at the Health Action Network. And thanks to all of you. This is a really scary rule. It takes all of us working together to push back, and I especially want to thank Gabrielle, who's been working tirelessly on this effort, yet still gave us an hour today, and Cecia, who is in a state and at an organization who's been fighting tirelessly, not just to protect the immigrant community, but to actually push proactively for better access to care and better services despite the really scary, unethical, cruel regulations that are coming down from the administration. You really create a light in the path forward. And to Cheryl, who's always been here showing us the way forward at Families USA to implement better and stronger protections. So thanks to all of you. Look for the resources, and have a great afternoon.